Hi, this is Ken Adams, and welcome to this edition of the Valley View. And joining me this week is Lee Mercer with Healthcare for All, Oregon.
That's correct. Hi, Ken.
Hi. So we have what is commonly referred to as Obamacare.
Mm-hmm.
So this would be different. So how is it different? And are there problems with Obamacare? Or is this just more of an expansion of Obamacare?
And kind of backing up,
Okay.
I got into the healthcare reform world via an organization I worked with for a couple of years, Main Street Alliance of Oregon, which is a coalition of small business owners around the state working on policy issues that impact small business, their communities, and our country. And I actually canvassed businesses, surveyed businesses door to door all around the state of Oregon as part of our organizing of small business owners. And one of the questions we asked was, do you have health insurance for your employees? And 85% of the businesses I talked to said no. And then eventually on several health-related questions, we asked, would you support a Medicare for all or, quote, single payer type healthcare system? And 60% of small business owners around the state, even in rural Oregon, were supportive of this idea. So we as Main Street Alliance got interested in this movement in Oregon, Healthcare for All Oregon, to move toward a more publicly funded universal program like most of the civilized countries in the world, Canada, Britain, Germany, you name it, this is the kind of system they have. And so that's what we're moving toward, and that's kind of the next step after Obamacare. As Main Street Alliance, we were supportive of the idea of covering more people, of getting rid of the limitations on pre-existing conditions,
Right.
and so forth. But as long as people are paying huge co-pays, huge deductibles, my wife is spending $600 a month for her health care, and with all these co-pays and deductibles, you know, she gets a bill and she pays $200, the insurance company pays $40. So I'm not sure how well covered people are with the current system.
So that was your motivation for kind of getting into the organization and saying, so it kind of led into the other. So what are the advantages of healthcare for all? And I guess I should back up because I'm now on Medicare because I'm that age. And I found it very easy to enroll in Medicare and get coverage. And I actually went through Kaiser's Advantage plan, so I have like a regular doctor. I don't have to, you know, go see somebody else that's all usually in the same building if I need x-rays or whatever.
Yeah, essentially what the quote single payer system is an improved Medicare for all. It's just covering everybody in the country. People in countries like Canada don't think about having to pay doctor bills. They don't think about paying hospital bills. They pay their taxes. They don't know what percentage of their taxes they pay are paying for health care, but when they go to the doctor, it's covered.
You know, one of the interesting things, because I was already on Medicare, my wife isn't eligible yet, and she had to go through Cover Oregon last year. And it was very difficult. And one of the problems that she has is that she owns her own business, so it's very difficult to anticipate how much money you're going to make, because I was looking at some of her numbers over the last few years, and it's all over the place. And so, you know, it was very difficult for her to document what she makes and then to try to anticipate what she's going to make for 2014. And if it's coming straight out of your taxes that you pay, then there's no question. There's none of this big bill at the end because you made too much money.
Right.
And so on.
Right.
Is that a common problem?
It is, and my wife went through the same thing.
Oh, okay.
We actually own a business still in California, and she had been covering all her employees that wanted to be covered. And with the coming of the healthcare exchange, it actually worked out for them a lot better to go individually into the exchange, and then they got the tax credits or the federal money instead of her, and that worked out fine. But she lives in Oregon, so she had to go through the exchange here. And again, we know that the exchange had problems rolling
Right.
out, and I knew a lot of people working for Cover Oregon, and they were very dedicated, really working to build a good system, and they struggled with getting everybody signed up. But my wife's problems were a nightmare going through getting signed up, and then there were some glitches in the system, and somebody else with her name, she got their number. She ended up with no insurance for 2 months, which is not a good thing in your 60s
No.
to not have insurance. So she is now covered, but it's a pretty, even though it's like a silver level plan, it's kind of patchwork in terms of what the coverage you get. So essentially, some view the system as a way to, it's kind of propping up the insurance industry, the health insurance industry. And when you go to a single payer system, you no longer have the health and insurance industry creating a lot of additional overhead for billing and admin on the system.
Well, it's interesting because I work for an insurance company in California. And one of the things I noticed, because I worked in data processing, was that all these companies would send us their information in different formats, which then required them to program for this particular company. And some of the companies would be somewhat similar, you know, as far as the information they were giving you. But for example, some companies would just send you what we call adds and deletes, the people that were added this month and the people that were deleted this month. Other people would send you the complete history of people back from when they first started. And so you'd have to try to figure out, okay, who did they add and who did they delete this month? And so it created quite a bit of problems programmatically for trying to see who was covered. And it was interesting because it was so chaotic sometimes, you know, just with a few clients that I guess we had about 300 or 400 clients, and it was difficult. So that's an example of, you know, Medicare has all this already taken care of. It would just basically be an expansion of Medicare, I would presume, is what you're looking at, so that you don't have to be 65 to join.
Right, and it's documented that the admin percentage of Medicare is a low percentage. I think it's in the
About
5%.
Yeah, about 6 or 7.
6 or 7% range. And we have, with Healthcare for All Oregon, we have an economist from the University of Massachusetts, Dr. Gerald Friedman, that's been doing some numbers on us to see what it would look like to do a system like this in Oregon. And his numbers, as well as numbers supporting the national bill, H.R. 676, that would create a national system, both indicate that about 20% of the cost of health care is all of this spaghetti of admin between dozens or hundreds of insurance companies, and then all of those entities that the billing people for doctors' offices and hospitals need to deal with. This is a huge piece of the cost of health care. You eliminate that, and you're knocking off 20%, along with, you know, bringing down the cost of pharmaceuticals, about 20% of the cost of health care, which is not insubstantial.
And you were talking about medications, because I believe in Canada, they do use the fact that they basically buy in bulk to keep the prices down.
They do.
And that's one big advantage that we certainly don't have here, because Congress about 8 years ago put something through to say that we couldn't do that. And to me, that didn't make a whole lot of sense unless you were trying to subsidize the pharmaceutical companies.
Yeah, separate from the issue of single payer, if Congress would just give more power to the federal agencies to negotiate on the price of pharmaceuticals, it would be huge. Some countries like Italy do that, where there's a strong control of the price of pharmaceuticals. In Canada, interestingly enough, it actually takes dental and pharmaceuticals actually are a supplemental policy, so you're covered with your taxes for doctors and hospitals, but there are small supplemental policies. So a business owner may carry a supplemental policy on their employees of $150 to $200 a month covering dental and pharmaceuticals. But again, the price of pharmaceuticals in Canada are much lower than here.
So what are the prospects here in Oregon for this to actually come about?
Well, Oregon's among about 26 states working on this now. And it's not an easy battle because there's a lot of established interests nationally that would rather we don't go to this kind of a system. This historically goes back to even the Truman era. The American Medical Association started hiring PR people that began demonizing the idea of this kind of system and calling it socialized medicine. So this PR campaign way predates Obamacare and that fight. It goes way back. I mean, we've been actually working on trying to get a national healthcare system since Teddy Roosevelt. So that's over 100 years.
That's well before my time,
yeah,
even.
definitely before my time. And so the established interests make it really difficult. But here in Oregon, the background of the movement is, back in the 90s, a lot of advocates here were working on the idea, and there was actually a ballot measure in 2002, Measure 23, that attempted to create a single-payer system in Oregon. It frankly wasn't written well, and the folks working on it hadn't done their homework and worked with they hadn't worked with business, they hadn't worked with labor to kind of make sure the language was good. And then a lot of money came in from out of state and helped defeat that measure. Well, in the interim, the small groups around the state that were working on this kind of healthcare reform unified in the last 3 or 4 years under Healthcare for All Oregon. So there's Mid-Valley Healthcare Advocates in Corvallis, and there's the Jobs with Justice Healthcare Committee in Portland, and then there's the various chapters of the Physicians for a National Health Plan. Lots and lots of people are working on this issue, but they'd never started working together until 3 or 4 years ago when we formed, or before my time, the Healthcare for All Oregon was formed. And it's a coalition that's built up to, in our last board meeting last Saturday, we brought on 3 more organizational members, so there's 103 organizations, including 25 unions supporting this idea. And there's close to 14,000 people on our database kind of working on this around the state with about 20 chapters in local areas.
You know, one of the things that I quite often hear in regard to, well, the Canadian system is, oh, they have to wait all these long months sometimes to get surgery or whatever.
Yeah.
And so maybe you could talk a little bit about that, because I know that's one of the big things that they always like to trot out.
Yeah, it is. It's one of those urban myths that, you know, when I was surveying businesses, for some reason I heard that kind of story in Eastern Oregon, in Pendleton and in LeGrand was where I heard it most often. I don't know why, but we have a film that we show often all around the state in house parties and in churches. It's called The Healthcare Movie. And if you Google the healthcare movie, you'll find the website. But the producers actually live here now in Salem. One is from Canada, one is from the States. And this movie interviews, one of the people in the movie interviewed over 300 people in Canada about their healthcare system. And one person was negative, the other 299 were positive. And they wouldn't trade their health care system for what we have here in the States. They just love it, or at least they're very on the positive side of the spectrum. But and then they go into stories of various individuals, stories of a young baby that needed heart surgery that was flown by the healthcare system there to Edmonton from another province and taken care of, and the parents are put up in a hotel, and it's all under the system. It's a really comprehensive system there.
Yeah, and I'm speaking of my wife. She broke her wrist about 5 years ago, and since I had health coverage, you know, they actually had to do surgery and put a plate in her arm, and so, you know, she complains about it occasionally. But a friend of ours that we kind of know, she also broke her arm, her wrist, kind of in that same area. And she didn't have health care coverage. And basically she went to the county hospital where she was living. They put a cast on it. And now she can't get it straightened out. She can't really use it a whole lot. And it looks odd too, for that matter. And that's kind of the results of sometimes people not having coverage. Also, I know that one of the places where I used to work, my coworkers would quite often drop coverage for a year because he just couldn't afford it. And I thought, you know, he was about late 40s, early 50s, and I thought it was kind of dangerous to be doing that.
Yeah.
And it causes people to make decisions that put them at risk, health-wise and financially. And so I kind of worry about what the system that we have now, even with Obamacare, because it seems like people are still being kind of forced into making those kinds of decisions.
Absolutely. I mean, the mitigating factor is at least there's maximums on out-of-pocket and so forth, but the reality is people are making their healthcare decisions based on whether they have the money in their pocket for those co-pays and deductibles, and that shouldn't be influencing your decision. A medical decision should be a medical decision, and it shouldn't be about whether you can afford it or not.
Well, I know that myself. I don't go to the doctor very often, but when I'm not sure about something, I want to be able to go to the doctor. So either to get reassured that it's no big deal, or to take care of something early, because the problems start to really pile up if you wait to get things taken care of.
It is. When I was surveying business owners around the state, this came up. I mean, people would. A beauty salon owner on the coast, I forget the city, but there's story after story of horror stories where the person got cancer, they lost their insurance, or the person got ill, lost their business. I mean, there's just horror stories everywhere we go. On our website, www.hcao.org, we have dozens and dozens of stories on video of various folks talking about the experiences they've had because we don't have a healthcare system, we have a health insurance system.
Leave no insurance company behind? Well, that's what I refer to. Actually, the first installation, when the Clinton administration was trying to push something forward, that was the way I kind of looked at it then, and it doesn't seem like it's that much different under the Affordable Care Act.
Right.
And you know, when I want to go see a doctor, I don't want to go see an insurance agent to find out if they'll cover me or not.
Right.
So you're going to have a kind of a demonstration at the Capitol on February 11th, around noon.
Yeah. Yeah, so as you were asking about getting to this in Oregon, and what we're basically doing as a movement is each session we're running a bill on a single payer system for Oregon. We did one in 2011 and we had 10 sponsors. 2013 we had 24 sponsors. Our goal this session is to get 36 sponsors. We actually either don't anticipate that the legislators will actually pass this because it's a big step, or if they do pass it, that the insurance companies will come in and bring it to ballot measure. So eventually the voters will decide on this. But it's all about educating voters and legislators on the desire of folks to have a universal publicly funded system. So we are going into the legislative session on February 11th. We'll have a rally from 11 a.m. to 1 p.m. on the steps of the Capitol. Our goal, we had 1,000 people there in 2013. Our goal is to have 2,500 people. We do have busloads of people coming from Medford, Eugene, Corvallis, LeGrand, Portland, and all over the state, and we'll have a lot of people there making some noise for universal health care.
And so you kind of indicated that this will probably come up as a ballot measure. And so there'll be a lot of money poured in against this ballot measure. So what steps are you taking to kind of forestall, well, maybe you won't be able to forestall it, but kind of inoculate yourself to that kind of campaign?
Inoculate is a good word. We really need, and this is why we're showing this healthcare movie all around the state. This is why we're tabling at farmers markets all around the state. This is why we have activists all around the state doing grassroots education and outreach to the public, because eventually the voters will have to decide, and enough voters need to know that this is a good system, this is going to be the most equitable system, and it will work work for everybody, everybody in, nobody out, everybody has coverage. And when we have that many voters behind us and are inoculated against the arguments that the insurance companies will bring and bombard us with on television, you saw the GMO campaign in the last election, and $20 million came in to defeat that. We need to be ready. We need, yeah, narrowly, but we need to be ready for that.
So you mentioned that there's 25 or so unions backing this, and what other groups are supporting this?
Many faith groups, a lot of community groups of various kinds, Main Street Alliance and other business groups, and we have a lot of local chapters, so each of them is an entity in itself, but we have chapters, very strong chapters in LeGrand, Corvallis, Eugene, Rogue Valley, probably 8 or 10 chapters in the Portland metro area, where folks are basically organizing in support.
And so you're going to be doing a lot of tabling at farmers markets. That'll be starting this spring then, I would think, in a couple of months or so?
Yeah, generally spring and summer and early fall, the farmers markets are popular. We end up, doing screenings at churches. The healthcare movie has actually been shown all over the United States, because we're not the only state trying to move that. And if community groups are interested in a way to really kind of get a perspective on the differences between the Canadian and the U.S. system and how different they are since the 60s when they diverged, this movie, I recommend this movie a lot to be shown. It's super educational, and the father of what they call Medicare in Canada, Tommy Douglas, who was a preacher prime minister in Saskatchewan, and Saskatchewan as a province took this on first, decided they were going to do this. The doctors actually went on strike against it, and this was all negotiated out, and Saskatchewan achieved the first kind of universal system in Canada. Then by 1970, the whole country had it. And Tommy Douglas, the founder, was voted by the viewers of the Canadian broadcasting system the greatest Canadian of all time. So this is another argument that their system is actually fairly popular.
Well, it's my father-in-law was originally from Canada, Winnipeg, and he was quite conservative for the most part, but he always laughed at our medical system. He just thought it was a joke. And I it was one of the few things we actually agreed on. So, but it was from his perspective of living under that system for most of his adult life even. So, and I've known some other Canadians that think we're kind of foolish not to have something similar. What are I noticed that Vermont was one of the states that is pushing for a similar type system, but it's mostly going through the legislature right now?
Yeah, so Vermont, we were citing Vermont as the group that actually had achieved, and they did achieve, a legislative victory on this. The legislature passed a bill moving them to a Green Mountain Care that would take advantage of waivers available under the Affordable Care Act in 2017, which allow a state to go further as long as the basic requirements of coverage that the ACA, the Affordable Care Act, requires is achieved. The state can go further and do something more innovative, like go to a full single-payer system. And their plan was, in 2017, to use that waiver and move into a single-payer type system. In researching how to pay for it, what taxes are going to be used, how it's going to be structured, that becomes a more contentious process. And in that debate, recently the governor now has pulled back and is kind of saying, well, it's a costly thing. It costs money to do health care, and we're going to slow down, and we're not going to make those deadlines. And so the advocates that have been pushing for this are very upset, and we that were looking to Vermont to be the leader in this are upset that they're not going to be kind of pioneering, but Oregon might end up being the pioneer. So now we might be the first state.
Well, it is interesting too that, like, you were talking early about socialized medicine, and we do have a socialized medicine system in this country, and it's called the VA, because you have to go to VA hospitals and clinics as opposed to any doctor you want. And the Canadian system, yes, it's the public at large pays for it, but there's the doctors, you can go to see any doctor you want, so the doctors are still private. And also in England, they have kind of a socialized system where you have to go to their facilities. But a lot of countries don't do it that way.
Right.
Canada is an example. I believe France and Germany are other examples of that. And one of the cases that I found very interesting was Switzerland, because I guess it was about 10, 15 years ago, they decided there were too many people in their country that weren't covered. And the percentage that they were worried about was this 5%, where I'm not sure of the current numbers under the Affordable Care Act, but it's probably closer to 30% that we have uncovered still to this day. So so they designed a new system that took their cost way down per capita that they were spending on healthcare, which also Canada spends a lot less than we do. And now that Switzerland isn't being compared to us, it's basically per capita, other countries come in at about half of what we spend.
That's right. That's right.
And some even less than that.
Yeah. In the Canadian model, again, I on the film, it was we're spending about $8,000 per capita per person on healthcare, and Canada's around 4,000. And then it goes down from there. From a number of modern industrialized countries spend a lot less than we do, for sure, on healthcare.
So we're going to have a big event on February 11th from 11 to 1 p.m. at the state capitol. And are you going to be then lobbying the various representatives?
Yeah. On the day, February 11th, if folks want to come early, we're going to do legislative briefings at the Micah Center, which is 600 State Street by the Methodist Church. It's a building of the Methodist Church, and the Congregational Church at 700 Northeast Marion. There'll be legislative briefings at 10 a.m. at both of those churches. We wanted to indoors in case it's raining. And then folks will walk to the Capitol, and we'll be converging at 11 a.m. We'll have music and a review called the Mad as Hell Doctors, which are these, actually a group that went across the country in 2009, doctors that were speaking out for single payer during the Obamacare debate, but that single payer was completely ignored, of course, at the national level. They have some routines they're going to do, but in the afternoon after the rally, people from all over the state will be visiting with their legislators and letting them know that they are interested in the system.
Well, Lee, I want to thank you for coming in and enlightening us as to what's going on with health care for all here in Oregon. And I want to invite you back next week for another episode of The Valley View.